Can you pass the NCLEX-RN exam? Here are 50 real practice questions with answers. Try to answer each one before the 5-second timer, then I'll show you the correct answer and why. Subscribe right now so you don't miss our new free practice tests every week, and get the full test free at preppass.org. Let's begin. Question 1. A charge nurse is assigning tasks at the start of a shift. Which task is appropriate to delegate to unlicensed assistive personnel, UAP? A. Taking vital signs on a stable postoperative client. B. Performing the initial assessment of a newly admitted client. C. Adjusting the flow rate of a continuous 4 infusion. D. Teaching a client how to use an incentive spirometer. The correct answer is A. UAP may perform routine, standardized tasks such as vital signs on stable clients. Assessment, for titration, and client teaching require the judgment of a licensed nurse and cannot be delegated. Question 2. A nurse must see 4 clients. Which client should the nurse assess first? A. A client scheduled for discharge who needs teaching. B. A client reporting new onset shortness of breath and chest tightness. C. A client requesting pain medication for a headache. D. A client asking for help ambulating to the bathroom. The correct answer is B. Airway and breathing problems take priority. New shortness of breath with chest tightness may signal a life-threatening event and must be evaluated before less urgent needs. Question 3. Which nursing task is appropriate to delegate to a licensed practical/vocational nurse, LPN/LVN? A. Developing the initial plan of care. B. Providing discharge, teaching about a new diagnosis. C. Administering an oral medication to a stable client. D. Performing triage in the emergency department. The correct answer is C. LPNs/LVNs may administer many routine medications and reinforce teaching for stable clients. Care planning, initial teaching, and triage require the broader scope of the registered nurse. Question 4. The nurse is caring for 4 clients. Applying the ABC framework, which finding requires the most immediate action? A. Blood pressure of 148/88 mmHg. B. Temperature of 100.8 F, 38.2 C. C. Reports of mild incisional pain. D. Oxygen saturation of 86% on room air. The correct answer is D. An oxygen saturation of 86% reflects a breathing and oxygenation emergency and takes priority over an elevated blood pressure, a low-grade fever, or mild pain. Question 5. A nurse delegates client hygiene to a UAP. Which statement reflects the nurse's continued accountability? A. The nurse remains accountable for the overall client outcome and must follow up. B. The UAP is fully responsible for the outcome once the task is assigned. C. Accountability transfers to the provider who wrote the orders. D. No follow-up is required if the UAP is experienced. The correct answer is A. Delegation transfers the task, not the accountability. The RN retains responsibility for the outcome and must supervise and evaluate the delegated care. Question 6. Which situation is the highest priority for the nurse to report to the oncoming shift during handoff? A. A client whose dressing was changed 2 hours ago. B. A client with a newly inserted chest tube and unstable vital signs. C. A client who ate 100% of the evening meal. D. A client who ambulated in the hallway without difficulty. The correct answer is B. Handoff should emphasize the least stable, highest risk client. A new chest tube with unstable vital signs requires close monitoring and clear communication to ensure continuity of care. Question 7. A nurse observes a coworker preparing to administer a medication without checking the client's identification band. What is the nurse's best initial action? A. Report the coworker to the State Board of Nursing. B. Document the observation in the client's chart. C. Remind the coworker to verify 2 client identifiers before administration. D. Say nothing because no harm has occurred yet. The correct answer is C. The immediate priority is client safety. Reminding the coworker to verify 2 identifiers prevents a potential error. Formal reporting is reserved for repeated or unresolved unsafe practice. Question 8. The nurse is planning care for a group of clients. Which client is most appropriate to assign to a newly graduated RN? A. A client requiring titration of a vasoactive drip. B. A client actively receiving blood who is having a reaction. C. A client being emergently transferred to the ICU. D. A stable client needing routine postoperative care on day 2. The correct answer is D. A new graduate should be assigned stable, predictable clients. Complex, rapidly changing situations such as drip titration, transfusion reactions, and ICU transfers require experienced staff. Question 9. A client refuses a prescribed treatment. Which action by the nurse best respects client autonomy? A. Documenting the refusal and notifying the provider. B. Administering the treatment because the provider ordered it. C. Telling the client they will be discharged if they refuse. D. Waiting until a family member can convince the client. The correct answer is A. Competent clients have the right to refuse treatment. The nurse documents the informed refusal and notifies the provider, respecting autonomy while ensuring continuity of care. Question 10. Which of the following is the nurse's primary responsibility when a client signs a surgical consent form? A. Explaining the surgical risks and alternatives to the client. B. Verifying that the client's consent is voluntary and witnessing the signature. C. Deciding whether the client should proceed with surgery. D. Guaranteeing that the surgery will be successful. The correct answer is B. The provider is responsible for explaining risks, benefits, and alternatives. The nurse verifies that consent is voluntary and informed and witnesses the signature. Question 11. A nurse is prioritizing care using Maslow's hierarchy of needs. Which client need should be met first? A. A client's need for reassurance about surgery. B. A client's request to see the hospital chaplain. C. A client's difficulty maintaining a patent airway. D. A client's concern about the cost of care. The correct answer is C. Physiological needs such as a patent airway are the base of Maslow's hierarchy and take priority over safety, love and belonging, esteem, and self-actualization needs. Question 12. The nurse receives report on 4 clients. Which client should the nurse plan to reassess first after receiving report? A. A client with chronic stable heart failure awaiting discharge. B. A client with a healing surgical wound scheduled for a dressing change. C. A client requesting a snack before bedtime. D. A client who received 4 morphine 15 minutes ago and is now very drowsy. The correct answer is D. A client who is increasingly drowsy after 4 opioids may be developing respiratory depression and must be reassessed first to prevent harm. Question 13. Which task can the RN appropriately delegate to a UAP for a client on strict intake and output monitoring? A. Emptying the urinary drainage bag and recording the amount. B. Interpreting the significance of a low urine output. C. Deciding whether to notify the provider about the output. D. Adjusting the client's fluid restriction. The correct answer is A. Measuring and recording output is a routine task suitable for UAP. Interpreting values, clinical decision-making, and modifying the plan of care remain RN responsibilities. Question 14. A nurse is coordinating a client's discharge. Which action best demonstrates effective case management? A. Delaying discharge until every family question is answered in person. B. Arranging home health services and follow-up appointments before discharge. C. Providing only verbal instructions to save time. D. Leaving medication reconciliation to the community pharmacy. The correct answer is B. Effective case management coordinates resources across the continuum of care. Arranging home health and follow-up appointments promotes continuity and reduces readmission risk. Question 15. The nurse identifies a near-miss medication error that did not reach the client. What is the appropriate action? A. Ignore it because the client was not harmed. B. Record it in the client's medical record as an error. C. Complete an incident and occurrence report to support system improvement. D. Report it directly to the state licensing board. The correct answer is C. Near miss and error events are documented on an incident report for quality improvement. The report is not filed in the medical record, and licensing boards address serious professional issues only. Question 16. A nurse is supervising a UAP. Which observed action requires the nurse to intervene? A. The UAP raises the side rails after repositioning a client. B. The UAP offers a bedpan to a client on bed rest. C. The UAP reports a blood pressure to the nurse. D. The UAP applies a vest restraint without a current provider order. The correct answer is D. Restraints require a current provider order and specific criteria. Applying a restraint without an order is unsafe and unlawful, so the nurse must intervene immediately. Question 17. Which principle should guide the nurse when assigning client care during a staffing shortage? A. Match client acuity and complexity to staff competency. B. Assign the most clients to the least experienced staff. C. Give all unstable clients to a single nurse to concentrate care. D. Distribute clients randomly to save time. The correct answer is that safe assignment matches client acuity to the skill and scope of the staff member. Overloading unstable clients on one nurse or assigning complex clients to novices threatens safety. Question 18. A nurse witnesses a colleague documenting care that was not actually provided. Which ethical principle is most directly violated? A. Autonomy. B. Veracity. C. Beneficence. D. Justice. The correct answer is B. Veracity is the duty to tell the truth. Falsifying documentation violates veracity and is both an ethical breach and a legal risk. Question 19. A nurse is caring for a client on contact precautions for Clostridium difficile. Which action is correct? A. Use alcohol-based hand rub after removing gloves. B. Wear an N95 respirator when entering the room. C. Wash hands with soap and water after client contact. D. Place the client in a negative pressure room. The correct answer is C. Difficile spores are not reliably killed by alcohol-based rubs, so hand hygiene with soap and water is required. Contact precautions, not airborne precautions, are indicated. Question 20. Which client requires airborne precautions? A client with a draining wound infection. B. A client with influenza. C. A client with scabies. D. A client with active pulmonary tuberculosis. The correct answer is D. Pulmonary tuberculosis is spread by airborne droplet nuclei and requires a negative pressure room and an N95 respirator. Wound infections and scabies need contact precautions, and influenza needs droplet precautions. Question 21. When donning personal protective equipment, PPE, which sequence is correct? A. Gown, mask, goggles, gloves. B. Gloves, gown, mask, goggles. C. Mask, gloves, gown, goggles. D. Goggles, gloves, gown, mask. The correct answer is A. The correct donning sequence is gown, then mask or respirator, then goggles or face shield, then gloves. The correct order reduces contamination risk to the wearer. Question 22. A nurse is assessing fall risk. Which client is at highest risk for falling? A. A 30-year-old ambulating independently. B. An 82-year-old taking a sedative who is confused. C. A 45-year-old on bed rest with side rails up. D. A 25-year-old awaiting discharge. The correct answer is B. Advanced age, a sedating medication, and confusion together create a high fall risk. Interventions such as frequent rounding and bed alarms should be prioritized for this client. Question 23. Which action best prevents catheter-associated urinary tract infection, CAUTI? A. Keeping the drainage bag above the level of the bladder. B. Routinely irrigating the catheter every shift. C. Removing the indwelling catheter as soon as it is no longer needed. D. Disconnecting the tubing to obtain urine samples. The correct answer is C. Early removal of an unnecessary catheter is the most effective way to prevent CAUTI. The bag should stay below the bladder, the system should remain closed, and routine irrigation is not recommended. Question 24. A nurse discovers a small fire in a client's trash can. Using the RACE protocol, what is the first action? A. Activate the fire alarm. B. Confine the fire by closing doors. C. Extinguish the fire with an extinguisher. D. Rescue any clients in immediate danger. The correct answer is D. RACE stands for rescue, alarm, confine, and extinguish. The first priority is to rescue anyone in immediate danger before activating the alarm and containing the fire. Question 25. A client is receiving oxygen at 4 liters per minute by nasal cannula. Which instruction promotes safety? A. Post no smoking signs and keep open flames away from the oxygen. B. Allow smoking if the client stays 6 feet from the tank. C. Use petroleum-based lubricant on the client's dry lips. D. Increase the flow rate whenever the client feels anxious. The correct answer is A. Oxygen supports combustion, so no smoking or open flames are permitted near it, and only water-based lubricants should be used. Flow rate changes require a provider order. Question 26. The nurse is preparing to move a heavy client up in bed. Which technique protects the nurse from injury? A. Bend at the waist and lift with the back. B. Use a friction-reducing device and additional staff. C. Twist at the trunk to reposition the client quickly. D. Keep the feet close together for a narrow base. The correct answer is B. Safe patient handling uses mechanical aids and adequate help, a wide base of support, and the leg muscles rather than the back. Twisting and bending at the waist cause injury. Question 27. A nurse is verifying a client before a blood transfusion. Which action is essential to prevent a transfusion error? A. Begin the transfusion rapidly to reduce spoilage. B. Use a standard 4-line shared with dextrose solution. C. Verify the client and blood product with a second qualified nurse. D. Skip baseline vital signs to save time. The correct answer is C. 2 qualified staff must independently verify the client identity and the blood product to prevent an ABO incompatibility reaction. Blood is infused with normal saline only, and baseline vital signs are required. Question 28. Which environmental modification best prevents falls for a confused older adult at home? A. Using throw rugs to mark walking paths. B. Keeping the client in a dimly lit room to promote rest. C. Placing frequently used items on high shelves. D. Removing clutter and ensuring adequate lighting. The correct answer is D. Removing clutter and improving lighting reduces trip and fall hazards. Throw rugs, poor lighting, and out-of-reach items increase fall risk. Question 29. A nurse receives a client with a suspected external chemical exposure. What is the priority action? A. Decontaminate the client before further care. B. Bring the client into the main unit for assessment. C. Administer pain medication first. D. Obtain a detailed medical history before any intervention. The correct answer is A. Decontamination prevents ongoing harm to the client and protects staff and other clients from secondary contamination. It precedes routine assessment and treatment. Question 30. The nurse is teaching a client about safe medication storage at home. Which statement indicates a need for further teaching? A. I will keep my medications in their original labeled containers. B. I will keep expired medications in case I need them later. C. I will store all medicines in a locked cabinet away from children. D. I will not share my prescriptions with family members. The correct answer is B. Expired medications should be discarded because potency and safety cannot be assured. Keeping them for later use is unsafe and indicates a need for further teaching. Question 31. A nurse is caring for a client with a seizure disorder. Which item should be available at the bedside? A. A padded tongue blade to insert during a seizure. B. Wrist restraints to prevent movement. C. Functioning suction and oxygen equipment. D. A bright overhead light kept on at all times. The correct answer is C. Suction and oxygen should be ready to maintain the airway during and after a seizure. Nothing should be inserted into the mouth, and restraints and constant stimulation are not appropriate. Question 32. Which client should be placed in a private room with droplet precautions? A client with methicillin-resistant Staphylococcus aureus in a wound. B. A client with measles. C. A client with a Clostridioides difficile infection. D. A client with meningococcal meningitis. The correct answer is D. Meningococcal meningitis is transmitted by respiratory droplets and requires droplet precautions. MRSA wounds and C. difficile need contact precautions, and measles requires airborne precautions. Question 33. A nurse identifies a client with a latex allergy. Which action is appropriate? A. Ensure latex-free supplies and place an allergy alert on the chart. B. Use only sterile latex gloves for procedures. C. Keep latex products nearby in case they are needed. D. Assume powdered latex gloves are safe to use. The correct answer is A. Clients with a latex allergy require latex-free supplies and clear allergy alerts to prevent an anaphylactic reaction. Powdered latex gloves increase airborne allergen exposure and are unsafe. Question 34. The nurse is applying restraints to an agitated client per provider order. Which action is correct? A. Tie the restraint to the movable side rail. B. Secure the restraint with a quick release knot to the bed frame. C. Check circulation once every 4 hours. D. Leave the client alone to reduce stimulation. The correct answer is B. Restraints are tied with a quick release knot to a fixed part of the bed frame, never the side rails. Circulation, skin, and needs must be checked frequently, typically every 15 to 30 minutes. Question 35. A nurse is teaching an adult about routine health screening. Which recommendation is appropriate for colorectal cancer screening in average-risk adults? A. Begin screening only after age 70. B. A screening is unnecessary without symptoms. C. Begin screening at age 45. D. Begin screening at age 25. The correct answer is C. Current guidelines recommend that average-risk adults begin colorectal cancer screening at age 45. Waiting for symptoms delays detection of early, treatable disease. Question 36. A pregnant client at 12 weeks gestation asks about weight gain. Which teaching is appropriate for a client of normal pre-pregnancy weight? A. Weight gain should be avoided during pregnancy. B. A gain of 50 to 60 pounds is expected. C. Weight should be gained only in the first trimester. D. A total gain of 25 to 35 pounds is recommended. The correct answer is D. A woman with a normal pre-pregnancy body mass index is advised to gain about 25 to 35 pounds. Adequate, gradual gain supports fetal growth without excess maternal risk. Question 37. The nurse is teaching parents about infant nutrition. When is it generally appropriate to introduce solid foods? A. Around 6 months of age. B. At 2 months of age. C. At 12 months of age. D. As soon as the newborn shows hunger cues. The correct answer is A. Solid foods are typically introduced around 6 months, when the infant can sit with support and has lost the tongue thrust reflex. Earlier introduction increases the risk of choking and allergies. Question 38. A nurse is providing immunization teaching. Which vaccine is a live attenuated vaccine that is contraindicated during pregnancy? A. Inactivated influenza vaccine. B. Measles, mumps, and rubella, MMR, vaccine. C. Tetanus, diphtheria, and pertussis, TDAP, vaccine. D. Hepatitis B vaccine. The correct answer is B. MMR is a live attenuated vaccine and is contraindicated during pregnancy. Inactivated influenza and TDAP are recommended in pregnancy to protect the mother and infant. Question 39. The nurse is assessing developmental milestones. Which gross motor skill is expected of a typical 12-month-old? A. Walking upstairs independently. B. Riding a tricycle. C. Pulling to stand and cruising along furniture. D. Is skipping on alternating feet. The correct answer is C. By about 12 months, infants typically pull to stand and cruise while holding furniture, and many take their first independent steps. Stair climbing, tricycle riding, and skipping are later skills. Question 40. A nurse teaches a postmenopausal client about osteoporosis prevention. Which action best supports bone health? A. Avoiding all weight-bearing activity. B. Limiting sun exposure completely. C. Increasing caffeine and carbonated soda intake. D. Performing regular weight-bearing exercise and ensuring adequate calcium and vitamin D. The correct answer is D. Weight-bearing exercise plus adequate calcium and vitamin D strengthens bone. Inactivity and excess caffeine or soda contribute to bone loss. Question 41. A nurse is counseling an adult on tobacco cessation. Which statement reflects effective health promotion? A. Setting a quit date and using support resources improves success. B. You must quit immediately or it is not worth trying. C. Nicotine replacement never helps people quit. D. Cutting back is impossible, so do not attempt it. The correct answer is A. Setting a specific quit date combined with behavioral support and, when appropriate, nicotine replacement improves cessation success. Supportive, non-judgmental counseling promotes readiness to change. Question 42. The nurse teaches a new mother about breastfeeding. Which sign indicates the infant is adequately hydrated? A. Fewer than 2 wet diapers per day. B. 6 or more wet diapers per day. C. Dark, concentrated urine. D. A sunken anterior fontanelle. The correct answer is B. 6 or more wet diapers a day indicate adequate intake and hydration in a breastfeeding infant. Few wet diapers, concentrated urine, and a sunken fontanelle suggest dehydration. Question 43. A nurse provides teaching about a heart-healthy diet. Which choice best fits this diet? A. Fried chicken with buttered mashed potatoes. B. A cheeseburger with bacon and fries. C. Baked salmon with steamed vegetables. D. A processed deli meat sandwich with chips. The correct answer is C. Baked fish rich in omega-3 fatty acids with vegetables supports cardiovascular health. Fried, high-saturated fat, and processed high-sodium foods increase cardiac risk. Question 44. The nurse is teaching an older adult about safe physical activity. Which recommendation is appropriate for most healthy older adults? A. Avoid all exercise to prevent injury. B. Only exercise if pain is present. C. Perform only high-intensity workouts. D. Aim for about 150 minutes of moderate activity weekly plus balance exercises. The correct answer is D. Most healthy older adults benefit from about 150 minutes of moderate aerobic activity weekly plus muscle strengthening and balance exercises to reduce falls and chronic disease risk. Question 45. A nurse assesses a 4-year-old's language development. Which finding is expected? A. Speaks in sentences of 3 to 4 words and is understood by strangers. B. Speaks in single words only. C. Uses no recognizable words. D. Reads simple sentences fluently. The correct answer is A. A typical 4-year-old speaks in short sentences that strangers can generally understand. Single-word speech is expected earlier, and fluent reading comes later. Question 46. A nurse is teaching about skin cancer prevention. Which statement indicates correct understanding? A. Sunscreen is only needed on very hot days. B. I will apply broad-spectrum sunscreen and reapply every 2 hours outdoors. C. A base tan protects me from sun damage. D. I only need sunscreen at the beach. The correct answer is B. Broad-spectrum sunscreen reapplied every 2 hours, plus protective clothing and shade, reduces skin cancer risk. Ultraviolet exposure occurs on cloudy and cool days, and a tan is a sign of skin damage. Question 47. The nurse discusses recommended cervical cancer screening. Which schedule is generally appropriate for an average-risk woman aged 30? A. No screening is needed at any age. B. A daily self-testing at home. C. A Papa Nicolau (PAP) test every 3 years, or co-testing options per guidelines. D. Screening only after menopause. The correct answer is C. Average-risk women aged May 30 have a PAP test every 3 years or human papillomavirus co-testing at extended intervals. Screening should not be delayed until menopause. Question 48. A nurse counsels an adult on alcohol use. Which statement reflects moderate drinking guidelines for health promotion? A. Any amount of alcohol is required for heart health. B. Binge drinking on weekends is safe if avoided on weekdays. C. There is no upper limit to safe alcohol intake. D. Moderate intake means up to 1 drink per day for women and 2 for men. The correct answer is D. Moderate drinking is defined as up to 1 drink per day for women and 2 for men. Binge drinking is harmful, and lower intake is generally healthier. Question 49. A client newly diagnosed with cancer says, "I just can't believe this is happening to me." Which response is most therapeutic? A. This must be very difficult for you. Tell me what you're feeling. B. At least it was caught early, so try to stay positive. C. You should focus on your treatment plan now. D. Many people do well with this diagnosis. The correct answer is A. Acknowledging the client's emotion and inviting them to share feelings uses empathy and open-ended communication. False reassurance and changing the focus block therapeutic dialogue. Question 50. A nurse is caring for a client with major depressive disorder who states, "Life isn't worth living anymore." What is the nurse's priority action? A. Reassure the client that things will improve. B. Directly ask the client if they are thinking of suicide. C. Change the subject to reduce the client's distress. D. Document the statement and continue routine care. The correct answer is B. Safety is the priority. Directly asking about suicidal ideation assesses risk and does not increase the likelihood of self-harm. It opens the door to protective intervention. That's all 50 questions. How many did you get right? Comment your score below. If this helped you, subscribe. I post a new free practice test every single week. And you can get the full NCLEX test, with hundreds of questions, completely free at preppass.org. Good luck on your exam. You've got this.